Hello there, I'm Dr. Bohn. I just wanted to show a little bit about the poster that I just recently presented at the Post-Acute Long-Term Care Conference that I got to attend. And this was a study on virtual reality and if we could use this in palliative care as a distractor to reduce pain and alleviate some symptoms. So the background on this is using virtual reality, and that's, for those of you who don't know, that's where you put the apparatus over your head and you, as you're looking around, it is as if you are in a totally different location. I did have a little disclaimer I wanted to read. This is the poster that I presented, and it does not reflect the views of the Orlando VA, Veterans Affairs, or of the US government. So our premise was that we could use another modality other than chemicals and other than medications to improve pain, to decrease anxiety, to use a distractor to help the patient get to a different place and have a different mindset and have their symptoms managed without being able to take a chemical. So through this virtual reality, we had several different sites that are all working independently to try to bring this information together and to try to run these tests. We did have the method of providing the information to the veteran, getting the consent from the veteran, and then most of the time it was either a medical student, a resident, or myself. We just don't have the staff for a staff member to be able to run this study for us. But they would learn how to use the device, so they have to spend a little bit of time, make sure that it's been updated, and then they would provide that device for the veteran and stay with them during the use of that device. It's got to be a standalone device because we don't have Wi-Fi speed that can handle a lot of bandwidth if this device is not a standalone device. But we do have periodic updates that have to be done. So the device has to be charged, it's got to be updated, and the individual who is taking the device to the patient has to know how it works. So they have to use it a little bit first. Then after the device is given to the patient and they get to spend a little bit of time with it, then they get to provide us information about how they felt and what happened to their symptoms. So we ask them a few questions before. We give them a little bit of an education on how to use the device because it is new technology for a lot of the veterans. Many of them don't have this kind of experience. They've never had this virtual reality experience before. And then we would ask them some of the same questions at the end to find out, did it affect some of their symptoms? So what we would do is have them choose one of the sequences, and they had guided mindful relaxation, muscle relaxation. They had 360 panoramic views, which they really enjoyed because it is immersive. And like I said, it looks like you are there. There's a memory game, and no one really cared for the memory game. They don't like any kind of testing. We had a 360-degree scuba dive experience, and we did have some veterans that were scuba divers, and they really enjoyed the scuba dive adventure. We had a treasure hunt, the Waya brush, which is basically painting, music museum, and then a watermelon toss, which was kind of enjoyable. The problem we had is these are a lot of simplistic games. So they couldn't build an adventure and then return to that adventure and add on from where they were. So it was basically like a first level and only a first level. And I don't want to say it was remedial, but these games were not complex. And that's why the relaxation and the panoramic views and then the scuba dive seemed like they were the favorites of the veterans. We didn't have as many participants. Part of it was limitations of the staff that's available to provide the education to the veteran and then stay with that veteran. And then we did administer the test or allow the use of the device on several veterans that we were not able to capture that information because they wanted to use it and we just did not have the time to administer the questionnaire before and after because, again, of staffing issues. So veterans that did not have a lot of functional capacity, or if they were confused, if the device made them dizzy, because it can make you really dizzy. You're putting this thing on your head and you're looking around. So it was either administered with them in a chair or in bed. But if they had cognitive impairment, they couldn't use the device because we do have, handheld, so you could paint, or if you were doing the watermelon toss, there are handheld buttons that you do need to use, and without the person being seated, they could get really disoriented. So some of these limitations we just could not overcome. But the data from the pre-assessment or pre-use and then the post-assessment, we did see a dramatic reduction in some of those symptoms, particularly for some of the veterans. They truly enjoyed being able to use the device, and they felt like that after the use of the device for a period of a few hours, they could reminisce about that experience, and they really did enjoy it. Some of the veterans used it more than once, but many of the veterans, when they found out that this was the limitations of the device, did not have a lot of interest in using it a third or a fourth time. So our results did show that there was improvement, but we would have liked to have had a device that had different levels or had more capability to it. But we do need to be really careful about the type of the device because of the bandwidth issue, and then we certainly don't want anything that's going to trigger a PTSD type experience or a memory that's going to be upsetting. And that's why the panoramic views and the scuba dive and then the relaxation, I think those were some of the favorites. So our conclusions were that several of the participants really were excited about the device, really got good results from the device, and I think if we had some of these limitations that we could reduce, I think we'd have a lot better experience with the device. I was really proud to present this virtual reality. It's something that I'm happy to be able to offer the veterans, and we do continue to use this to try to give them a distractor and another option rather than pain medication to control pain or a nausea medication to control their nausea. So we did work on pain, tiredness, drowsiness, nausea. We also tested for lack of appetite, shortness of breath, depression, anxiety, and then their overall sense of well-being. That's the study that we evaluated, and this is the poster that I got to present. Thank you for your time. Thanks for being here. If you have a comment or you know how I can get a device that does these things, leave a comment below. Thank you very much. Bye now.